Good evening. We're talking on reproductive health. Introduction to reproductive health, presented by Mrs. Yetunde Elizabeth Adeniyi. Let's look at the outline. We'll be looking at what reproductive health is, the concept of sexual and reproductive health, components of reproductive health rights, reproductive health indicators, the summary and conclusions. What is reproductive health? Reproductive health encompasses a broad range of issues of factors affecting the well-being of individuals, especially the women, in relation to their reproductive systems, as well as other obstetrical and gynecological conditions affecting their health. It is a state of complete physical, mental, and social well-being, and not merely the absence of diseases or infirmity in all matters that is relating to the reproductive system, its functions, and process. What are the concepts? The concept of sexual and reproductive health. Access to safe and effective contraception methods. Ability to reproduce if the couples feel they want to, if they desire to. Prevention and management of reproductive system related diseases and disorders. Provision of comprehensive maternal and newborn care. Promotion of sexual rights. Quality components of reproductive health, quality family planning services, promoting safe motherhood. That is prenatal, during delivery, and postnatal, even when they are breastfeeding. Education and counseling on human sexuality is another component. Responsible parenthood and sexual and reproductive health. Prevention and treatment of infertility. Another component is treatment of reproductive tract infections, including sexually transmitted infections. Prevention and management of complications of unsafe abortion is another component. Safe abortion services, where it is not against the law. Active discouragement of harmful practices like breast ironing, female genital mutilation, which is common in this part of the country. Then functional and accessible referral. Let's look at reproductive, sexual and reproductive rights. Just like we have the human rights, reproductive health also has its own rights. The right to health, right to life, and right to live. The rights to education and information about reproductive health, the right to privacy, that is confidentiality, the right to decide the number and spacing of children, the right of consent in marriage and so equality, the right to be free from discrimination, the right to be free from practices that harm women and girls, those are the harmful practices, even to be free from violence. Now, let's look at reproductive health indicators. Reproductive health indicators are crucial metrics that are used to evaluate the status of reproductive health services and outcomes within populations. They are used to track progress, to identify gaps, and formulate health policies aimed at improving reproductive health outcomes. They are like total fertility rate, contraceptive prevalence, antenatal care coverage, births attended by skilled health personnel, prevalence of sexually transmitted infections, adolescent birth rates is another reproductive health indicator, availability of comprehensive essential obstetric care, then the percentage of obstetric and gynecological admissions owing to abortion. In summary, the introduction to reproductive health focuses on understanding the wide range of factors affecting women's reproductive health, including maternal health, family planning, sexually transmitted infections, and common obstetric and gynecological conditions. It covers crucial topics like sexual and reproductive health rights. We're able to look at the components of reproductive health, the critical reproductive health indicators like maternal mortality ratio, like total fertility rate, contraceptive prevalence, adolescent births, and the likes. Now, in conclusion, reproductive health is fundamental to enhancing the well-being and anatomy of individuals, especially the women. By mastering reproductive health concepts, the right components and indicators, healthcare professionals like nurses can improve care quality and accessibility for women. The course prepares students to assess reproductive health challenges, implement effective interventions, and advocate for equitable health policies. Ultimately, students are empowered to deliver high-quality services to women experiencing reproductive health issues. These are the references. Thank you. See you next class.